Hello, and welcome to HIV Reimagined, UNICEF's podcast about conversations for change. I'm your host, Dr. Shaffiq Essajee, and I'm Senior Advisor at UNICEF in New York. Here at HIV Reimagined, we speak to people across the healthcare spectrum from all around the world to share their experiences of new ideas in healthcare and the impact of doing things differently. Because if we know more about those new ideas, then together we can really start to look at what could be done next for HIV care. And today we're taking a look at telemedicine and other digital approaches to healthcare. From Zimbabwe to Uruguay with Botswana in between, today we'll be finding out which app has helped community workers build a whole new level of trust in their communities. We're going to be meeting someone who's using social media to change lives and even finding out whether tech needs to be new to do things differently.
The group has more young women feeling empowered that if they're unsure about something, they can refer to a sisterhood, which is the online safe space.
The UN now reports that for the first time in history, human development has started going backwards. It's very innovative to not try to go above and beyond.
One of the comments was, I would really have liked a lot to have this conversation space when I found out I had HIV.
It gives me confidence. The fact that I can put my information in my pocket on my phone, it's amazing.
Plus, I'm joined in the HIV Reimagined studio today by Emily Nicholson. Welcome, Emily. Emily is an expert in digital health with a passion for collaborating with health workers to design user-centered software and programs, and throughout her career has led the development of several digital health global goods and open source software that is being used by ministries of health and partners during Ebola in West Africa and during the COVID pandemic. Emily is currently the digital health business analyst for UNICEF's Latin America and the Caribbean. Emily, it's great to have you here as our first ever studio guest.
Thank you so much, Shaffiq. It's exciting to be here.
Our very first guest. And with so much to fit in, let's just get started. And our first stop was to talk to two people who are using a digital health tool to change the way they work. We caught up with Sostain, who is a community outreach agent for OPHID in Zimbabwe. OPHID work directly with the communities to help find clients who need support, to adhere to their HIV treatment plans and their medication, as well as reach out to hard-to-reach clients who are having difficulties accessing health facilities, and to coordinate them and link them back into care. We spoke to Sostain about the impact that Boost has made on his work.
My name is Sostain Moyo, and I'm a community health worker. We are like a bridge between the health facility and the patients in the community. Boost is an application, a mobile application that we use as a reference point. It's an educational platform. Normally, we would use it as a reference when we do meetings with our patients, when we talk to patients. When patients ask questions, we need to get correct facts. So normally we consult Boost to give us some ideas on what's trending, what's new, what information is new, and what's the correct information that patients might be asking. It has changed us from carrying a backpack in the community to carrying just a smartphone in my pocket. You have instant updates on certain information. If there is an outbreak somewhere, if there is a new information on COVID, you can easily get it and you answer most of the questions that come from the patients.
We're also lucky enough to talk to Sostain's colleague, Isabeli, about the difference she's found since using the app.
My name is Isabeli Mutasa. I am a community outreach agent coordinator in Tshepiso in Zimbabwe. Okay, so before we had Boost, providing information to the clients was a challenge because there are some of the things that we don't know by head. And clients might ask you something that is not even HIV related and you don't even have the answers. So before Boost, it was really, really difficult. And it was something that was embarrassing to tell a client that, unfortunately, I don't know that. Let me go and ask a nurse and then she will assist you. But when Boost came along, it was easy because we could actually use our phones and talk to the clients. It was easier. It's something that they see as legit when you take this and they see that is something that is approved and you're reading. So if it's something that is approved, then the information is correct rather than telling them something by head. Clients are now confident in the things that we tell them, and it's actually easier for us to explain the things. Some of the things that I don't know, I'll just open my application, go through the things with the clients together. And one thing that I like is it's pictorial. So when they see the pictures and you're explaining, and it demystifies a lot of things. There are the myths that we have in our community. So, for example, people actually believe that when you have HIV, you have AIDS. So with that application, it shows us the myth and it demystifies that, explaining to the clients, and it's actually easier.
When you're working in the community, you don't want to be a know-it-all person. You also want to show that you can make reference, you can refer, and you can consult. So when you're consulting the Boost, the clients will actually see that they can have confidence in what you are saying because it's factual.
Especially when we're talking to the young people. With the pictures, it's easy. When they see diagrams, they don't lose concentration. So when you're explaining to children, it's actually easier to understand. So I can confidently go to the communities full of information that I didn't know before. But because now I have an aid with me.
It gives me confidence. And also the fact that I can put my information or library in my pocket on my phone, it's amazing. You don't need to stop the process from going on and say, can you allow me to go and consult my books and come back and address you? No, you just take your phone out and then there you go.
So Boost is clearly having a huge impact for Sostain and Isabel, and also on the community they work with. But it's a two-way process. Working every day with Boost means that the community health workers are getting feedback about the app from both the community and their own colleagues. Improvements have already been made based on their feedback, such as making the app available offline so that users can access the content even when they don't have signal. But we wanted to know what features they'd like to see make even more of an impact.
I think the addition of vernacular language would help, because there are some clients where when we would like to translate things in our own words, would translate them wrongly. So if there was a vernacular language, it's actually easy to just read it out to them as it is than try to translate words in our own way, because we might interpret things the wrong way.
If we could have some video skits that can, with the same information, that can also be used for those who might need sign language and other communication techniques. So if we really want to be relevant and making impact, we should try to think of those that are harder to reach because of different circumstances. Some of the circumstances could be illiteracy, or some of the circumstances will be disability. So our platform should cater for all people and make sure that we create and package our information well so that it touches everyone and not leave anyone behind.
Emily, Sostain and Isabel raise one of the biggest questions about telemedicine. How do we make sure that digital health services don't leave people behind?
Such an important question, Shaffiq. I think we need to begin with addressing the digital divide, and specifically the gender digital divide. The digital divide is a term that refers to the gap between demographics in regions that have internet or mobile access and are therefore able to make use of digitally delivered services, and those that are excluded from these services. Thus, the gender digital divide reflects the inequalities between men and women in terms of their access to and use of digital technologies, and it's grounded in global gender inequality. I thought I'd share some quick facts supporting this that come from the 2020 GSMA Mobile Gender Gap Report, including the fact that 300 million fewer women access the internet than men, and smartphone ownership is 20% lower for women than men. Of course, as the world continues to move to more and more things being online, the cost of digital exclusion is increasing. In order to make sure digital health services don't leave anyone behind, we need to understand why people, and especially women, are currently being left behind. Affordability is one of the principal drivers of digital exclusion, as millions of people are priced out of the market. The use of digital services is particularly cost prohibitive for women. Many parts of the world still lack communications infrastructure such as fiber optic cables, cell towers, satellites, things that are essential to the provision of services. And there exists a lack of digital literacy or the skills to functionally use technology and the internet safely and securely, which continues to be a barrier for the adoption and use of technology, again, particularly among women. So in order to make digital services effective and available to all, we need to look at addressing affordability, the availability of communications infrastructure, and increasing education, particularly for women and girls, on the safe and secure use of data and tools that would help close that divide, as would addressing gender inequalities across the board.
Emily, those are really amazing points. As I think about the example from Boost, where do you feel that digital services like this have most positively impacted healthcare, especially in terms of extending reach and improving the way services are actually experienced by clients?
I loved hearing from Sostain. I could tell from his voice, just listening to him talk without even seeing his facial expressions, that Boost has made his job easier. It has literally and figuratively lightened his load. So the enthusiasm for digital tools and devices is real. I'm particularly impressed with the use of certain technologies such as mobile ultrasound that can be easily transported from one place to another and used to predict the probable date of delivery and screening for possible complications. I know our UNICEF Kyrgyzstan office is improving family health through telemedicine by creating provider-to-provider connections, enabling family doctors from remote health centers to connect with qualified health specialists at second or tertiary level facilities. So this is an amazing way to resolve unmet need at the rural primary healthcare level and also strengthen the capacity of family doctors in remote areas. That's a way to connect humans to improve health through the use of digital. But then there's also uses of digital devices like what's being piloted by the UNICEF North Macedonia office. They're using remote monitoring devices to conduct physical examinations of patients to diagnose acute conditions such as ear infections or upper respiratory infections. So instead of relying on a video conferencing system, the doctors are able to remotely examine patients' heart and lungs with high quality digital sounds or measure heart rate and body temperature. So things like this allow doctors not only to remotely monitor chronic conditions for the most vulnerable from the comfort of their homes, but they also allow for monitoring of patients post-procedure or keeping tabs on patients post-COVID-19 infection.
And it's not just about creating greater connectivity between users and providers. It's also about users having access to information, their own health information, in ways that don't require them to be in front of a provider or in a facility to be able to do that. From your experience over many years of working in this area, what do you think are some of the biggest issues with rolling out digital healthcare services? What would you like to see to try to mitigate those types of problems?
I would say it's really important to ensure that we are developing interventions with a patient-centered care focus. The goal of patient-centered healthcare is to empower patients to become active participants in their care, which requires health providers to develop good communication skills needed to speak with clients and to become patient advocates. And I suspect this is happening to some extent. In fact, I know it is with the development of telemedicine and digital tools. But I think it's imperative that companies and organizations designing telemedicine solutions work with both the providers of services and the recipients of health services to develop systems that work for them. It's really important that we keep that in mind so that everyone can truly reap the benefits of digital solutions.
For populations in developing countries, do you feel that the prospect of bringing digital technologies into homes, into the hands of women, could change the way people think about self-care. You know, if you had information about symptoms that you're experiencing, about concerns that you have with your family, would you actually be able to use that to change the way, to change your health-seeking behavior, to change your health prevention, disease prevention behavior in ways that might positively impact change?
I think that really depends on the user, the person on the other side of that data, and whether they trust the source from which the data is coming or the method in which that information is being received. Of course, in high-income countries, many people have different wearables and devices that track and monitor their heart rate, their sleeping patterns, and do use that information to change their behaviors, modify their diets, etc. But in countries where those resources are not as available, I think there's a much steeper learning curve to build trust in the availability and use of that information and that data.
Emily, you told us about the digital divide and then the even more worrisome gender digital divide. As we think about digital health services not leaving people even further behind, what should we be doing about addressing the gender gap?
Thanks, Shaffiq. Really working with women to design women-centric technology, working with girls to ensure that they are part of the user design process, that technology is built with them and for them. I think cultivating women and girls' confidence as well, that they're smart enough to use technology is exceedingly important, that the technology is for them and can support their needs and their academic growth and development. And then there's also the real need to create economic opportunities so that women have access to technology and the support that it provides.
Emily, thank you. Those are really great points. Putting users at the heart of any innovation. We've just talked about not leaving anyone behind with new digital health innovations. But does innovation always mean new technology? Viamo is an IVR, or interactive voice recognition platform, where users ring a toll-free phone number and use their simple phones to navigate audio content. Think of it as an audio Wikipedia you can get via a phone call, and all in the relevant local language. The content could be anything from a daily news digest to specific health or agricultural information, even games where you choose what the character does. Viamo currently has 21 live platforms across Africa and Asia, and in 2022, it had 18 million active users who listened to over 470 million pieces of beneficial content. We chatted to Leah Newman, Director of Product Management, to find out what a simple telephone call could offer users.
My name is Leah Newman. I'm the Director of Product Management at Viamo. The experience for the end user, they dial a toll-free short code and they access a menu of options that, again, is in their local language. When they reach the main menu, it's a curated list of topics that they can navigate to find what's most relevant. That can be, for health, press 1, for agriculture, press 2. Within health, you would then drill down into, for COVID, press 1, for family planning, press 2, for nutrition, press 3. But I think a lot of times there's a bit more exploration of, I have general questions about reproductive health, and I don't have someone in my life that I feel comfortable asking. But here is a platform I can access in my home, on my own phone, by myself, and it can be a bit more exploring content and learning as you go.
If people are already accessing a platform like this for health advice, what does that look like when a global health pandemic hits? Viamo were already set up with a remote workforce, and the platform had a dedicated user base who trusted the expert content which was validated by local ministries. So what happened when COVID-19 came along?
When the pandemic hit, we immediately saw a spike in users across the globe. And it was clear that they were looking for trustworthy information on COVID. And this was, just in the very early days. And we didn't actually have information on COVID. And so we moved very quickly to add approved content on all of our platforms to answer basic health information and combat misinformation. And in 2020 and 2021, we reached over 30 million people with COVID information. And we tested new information service delivery on our platform, such as a COVID symptom checker to help users make informed health decisions while helping governments monitor symptom clusters. You could easily imagine that a symptom checker could be used for many diseases outside of COVID, and even for identifying high-risk populations that are likely to need additional support.
Emily, that's just one example of how COVID impacted digital healthcare and opened up a new potential for how digital health services could be used. Have you seen other positive aspects to digital health services, or maybe acceleration within existing areas that resulted from the impact of COVID? And do you think that some of those innovations are here to stay?
Well, one thing that I've seen a large uptick in the post-COVID period is the use of digital platforms to widely share information and educational materials, whether with health workers, community members, parents, or adolescents. Governments, donors, and implementing partners are becoming more aware of the benefits of using digital platforms to train large numbers of health workers on specialized content, including the ability to reach individuals in remote locations, reduction in costs compared to hosting similar numbers of in-person trainings, and then the value of self-paced courses for adult learners. In my time at UNICEF, we've been receiving many, many requests from ministries of health and UNICEF Latin American country offices requesting to digitize content to be deployed on digital systems, whether through WhatsApp or more specialized learning platforms like Moodle. We've gone from providing trainings related to the COVID-19 response to receiving requests related to courses on routine immunization, the prevention of overweight and obesity in children, and courses on hospital administration and management. So if anything, COVID taught us that we are able to learn remotely, and in doing so, train up much larger groups of health workers for much less money than previously.
And actually much more quickly than previously as well. You can develop content and disseminate it from start to finish much more rapidly using digital technologies.
That's absolutely right. And it also allows health workers and others to access the courses at the time that best suits their needs. So they don't have to take time away from their jobs. They don't need to travel out of town to attend an in-person training, but rather can sit at home after hours and scroll through a course and learn on their own time.
Yeah, it's revolutionary. And talking of impact, it's time to hear from Leah again. We wanted to know if Leah had seen any examples of where the work Viamo is doing with IVR has led to tangible changes in real life.
In Tanzania, we worked with a partner, CCBRT, to put up information on fistula. They were also, as part of an information campaign, working with us, but as part of their work, offering free fistula surgery to women who needed it. And we had instances of women accessing our platform, listening to the content on fistula, learning for the first time that that's what they were suffering from, then calling the CCBRT hotline that was recommended in our key messages, and actually accessing free surgery, which is truly life-changing for somebody who's suffered from fistula for 5-10 years and been ostracized from her community, to not only learn that this is what she has, but to learn that there's a free way for her to have free surgery and change her life.
So with Viamo using a tried and tested technology, but in a new way, we asked Leah about what she thinks innovation could look like in the digital health space.
The UN now reports that for the first time in history, human development has started going backwards. I think it's very innovative to not try to go above and beyond, and knowing that if we do that, and there's many reasons to invest in exciting new technologies. And those will serve many of the world's vulnerable populations, but they will still leave behind the 3 billion underserved that are not ever going to be able, likely, to benefit from the internet, from smartphones. Even if data costs come down, even if smartphones become cheaper, that still doesn't help those, who can't use those phones. It doesn't replace the fact that most of the internet is in just a few languages that you would still have to read, that you would still have to be able to Google and, be able to ask questions of the internet and get trustworthy information back in a language that you speak. And those barriers are real, and they're not going away anytime soon. I think there's room for every solution in the work that we're all trying to do.
Thanks so much, Leah. Emily, Leah makes a really interesting point. Does innovation always need to mean something new?
No, I don't think innovation is always meaning new, as in new products. Perhaps new as in new and improved ways of doing things, such as providing farmers with information over the radio on a range of agricultural techniques to increase their crop yields. That's pretty simple. The best innovations are things that are simple and easy to adapt. But innovations aren't effective unless they can scale or have meaningful impact at scale.
Emily, Leah highlighted how using this low-budget technology can actually allow you to program in vernacular languages. That's an important way of closing the digital literacy gap. What do you think are other ways that we could try as users, as healthcare workers, to try to enhance digital literacy?
This is a real passion of mine, Shaffiq. Addressing gaps in digital literacy is so important. We talked about the gender digital divide earlier, men not only having more access to the internet, but for those women who do have access, there's a growing and persistent gap in their meaningful use of technology. For me, employing an empathy lens when developing trainings is essential, as is using human-centered design processes to identify the barriers that prohibit the use of digital tools, and then to work with end users to design solutions that enable their effective use.
Wow, you come up with pretty amazing stuff off the cuff, Emily. I hear your passion.
It's so important to me. I'm such a perfectionist.
But what about using the spaces and places so many of us are already familiar with on the internet? As of the start of 2023, over 4.74 billion people across the world are using social media. That's over 75% of people aged over 13. And the countries that are spending the most time on it are Nigeria, Brazil, and South Africa. We spoke to Lucila Suarez Battan, founder of health tech company Talk to You, who uses behavior change science combined with storytelling on digital platforms that users already feel comfortable on to educate, empower, and ultimately to shift behavior. Here's Lou to tell us more about how it works.
My name is Lou Suarez Battan, and I'm currently living in Uruguay. Talk to You is a health tech company where we build therapeutic conversations to improve youth mental, emotional, and social well-being. We created projects around sexting, for example, healthy relationships, women empowerment, hate speech, and HIV. What we do is create innovative content to create stories or interventions, specifically to create behavioral change and awareness about the different topics that we're going to address. For example, is create a project called Topity. This is a chat experience where you just dive into the possibility of experiencing different interventions around self-esteem and body image. The idea is to provide them with tools to be able to overcome the daily challenges that they might have. This could be having a difficult conversation with your mother, and maybe she's doing it with a good intention, like trying to help you out, but whatever she says makes you feel worse. So we give you the tools just to handle those type of situations that are maybe on a day-to-day basis. And the interventions basically are strategies that we propose, created with academics, experts that actually know techniques, and we translate them in a normal way of speaking and language. So this is something that's more informal, relatable to young people. So we use a different language, tone, the way we express things is more oriented to how they actually do speak, because the idea is that we provide something that it's enjoyable, engaging, but also that has the actual effect that we want to create.
Emily, this is a project that you actually put forward as a great example of doing things differently when we first contacted you about the podcast.
I am a huge fan of the Talk to You platform and the work that team is doing. So happy that they're included here.
And Talk to You's approach is clearly working, with over 2 million young people already reached. We asked Lou why it's so important that they use existing platforms for the work they're doing.
It's very intuitive because basically we use the same way of communicating as you would do it with your friends or your family. So it's just a chat conversation. We send you a message, you respond. We send you a message, you respond. So it's very easy because it has to be really how you actually communicate with the people that are in your life. From the feedback that we've got, we are those friends, knowledgeable friends that might know a little bit more than their current peers, where they can open up. And knowing that it's also a bot allows some sort of security, because they don't need to get exposed. Like right now, we know that young people don't like to speak over the phone, or maybe having somebody in front of you feels that they are going to be judged, so you don't open up as much. But when we're doing this via digital platform, where you know that even though you feel that the other person might be real, you know that it's not. So you have this possibility to be a little bit more open and just try to address your feelings in a different way. For example, not long time ago, we had a focus group with young adults that are working with us on a project around HIV. One of the comments was, I would really have liked a lot to have this conversation space like we had here, that when I found out I had HIV. From that group, another person said, many of those who work with us in this issue are slow to understand or never even understand the language and the tone that we need to communicate this type of things.
Thanks so much, Lou, for talking us through the work you're doing at Talk to You. If you'd like to know more about this or any of the projects or people mentioned today, please head to the HIV Reimagined episode notes or to our blog at childrenandaids.org/HIV Reimagined. So, Emily, we just heard that being in spaces people already are in, like social media spaces or messaging apps, and being truly authentic can help users feel more comfortable or vulnerable, as Lou said, than if they were in face-to-face scenarios with a real person. Do you think direct access to digital services can help navigate around some of the barriers stopping people from accessing traditional care?
Yes, Shaffiq, there are certainly ways in which access to digital services can alleviate barriers around access to care. If you don't mind, I'll share a personal experience that helps illustrate this point. Years ago in graduate school, I was working with a team of doctors in a women's clinic in rural Honduras, over 100 miles, or I think it's about 160 kilometers from the capital, Tegucigalpa. To travel to Tegucigalpa for an appointment, they'd have to leave very early in the morning, pay for transportation, and sit in a waiting room until they were called, as many clinics operate on a first-come, first-served basis. This could take hours, and then travel back home. Most of the women were unwilling to travel alone, so they needed to be accompanied by a friend or family member, which, of course, would double the cost of the trip. It was impossible for them to afford to stay in hotels overnight, and most of them had children, so they'd have to find someone to care for their children for an entire day in their absence as well. So think of all of the barriers that telemedicine can alleviate in this particular story. There are no costs associated with transport, no need to find a friend or family member to accompany you on a trip to the capital. And instead of asking someone to care for your child all day, you might just be asking for a favor for an hour or so, the time it takes the doctor to conduct the appointment. In situations like these, the use of telemedicine can definitely lift some of the barriers women face when accessing medical care.
How do you find the balance when you're programming between trying to deliver a service through a digital means that is truly going to capture the largest group of clients?
I think The best way forward is to know our users. We need to design programs and technologies that work for the individuals we are trying to reach, which means defining and designing products for both digital natives and tech-enabled populations, but then also for those at the last mile who don't have cell phone service and may never use a cell phone in their lives.
Emily, that's a great point about the importance of listening to users.
So we've heard from a project using chat functionality to connect remote users. But what about using digital technology to connect with real-life peers and professionals in health facilities? In 2017, FHI 360, through the Advancing Partners and Communities project, launched a closed Facebook group called the Cookie Jar. The group served as a safe, non-judgmental space for adolescent girls and young women in Botswana, aged 15 to 24, to discuss any topic related to relationships, HIV, sexual health, and gender norms. The discussions and conversations were moderated by trained content managers who were young women of the same age group. Some of the most popular topics discussed were treat all, at-home HIV testing, pre-exposure prophylaxis, contraception, sexual violence, and gender norms. Their successes have included more than 1,000 members, hundreds of posts, and nearly 80 young women receiving referrals to professional counseling and health services. We spoke to Tshepiso, the founder of the group and content marketing administrator at Tebelopele Wellness Centers, to find out a little more about why she thinks the group is succeeding where other health communication interventions have failed.
My name is Tshepiso. I am the overseer and the founder of the Cookie Jar Facebook group. I supervise 3 young women who are currently the content managers of the group. So the actual jar is the issues that young women bottle up, and the cookies are the issues themselves that young women don't normally talk about. So we decided, okay, we're going to create a group where we're going to talk about, unpack these sexual health issues and also link these young women for services. We help them open this cookie jar and actually nibble these issues. By nibbling these issues, we help them unpack them. We help them talk about these issues that they can't talk to anyone at home or their friends. And we actually give them solicited advice so that they can get the medical attention they might need at that point in time and not necessarily get any advice from people that do not know certain relevant places, like we do have our own clinic called Developel.
Tshepiso took us through some of the ways the Cookie Jar works hard to create a safe space with measures like rules for the community, checklists on who can enter the group, and also providing the option to post anonymously. However, Tshepiso thinks it's the users themselves that have some of the greatest impact on each other.
They have the option to post anonymously. So whatever it is that they may post in the group, no one might know, but they can get the help that they need at that point in time by other people sharing, their stories and how they managed to overcome a certain situation that the young women might be going through at that point in time. Sometimes, you have content managers posting, let's say on Monday, we're going to post about family planning, and others will have maybe the testimony of, no, maybe, I feel like an implant would be best for me, or I feel like actually an IUD would be best. And then they all share their experiences that, okay, no, I had these side effects. I don't know how maybe you would feel about it. So it's just like that community and that support group that, okay, I'm not alone in as much as maybe I might be going through certain issues. It's easy for them to take note of okay, and learn from each other as well. The same conversations they can have with their friends. Just that sometimes when you have conversations with friends, it's misguided conversations in a sense that, there's no expert to vet certain things that friends tend to advise you on. In as much as they love going to Google symptoms or whatever it is that they may be going through. They have us on the ground, us being the mediators we get the information from our doctors, and our doctors give us this information, and then we relay the information in a manner that they can understand. The group has more young women feeling empowered, self-assured, that they're making the right decisions, knowing for a fact that if they're unsure about something, they always can refer to a sisterhood, which is the online safe space.
And the sisterhood works in real life too. When we were talking to the cookie jar, we heard examples of the community supporting each other offline as well. For example, by hosting each other when they needed to be nearer to services. We asked Tshepiso what she feels the cookie jar is doing differently to better suit the health needs of the young women it supports.
I mean, the young women always have the information they need at their fingertips, which makes it more convenient than visiting the facility. And it is one way that it differs from the standard support services. And also, additionally, there's continuous engagement within the group. You always have people online ready to assist you and talk to you. There's no such thing as operating hours. And also just being part of, a group member reduces that anxiety and fear of going to the clinic. As a young woman, you already know and you are assured that, okay, fine, the same person that I'm speaking to online is the same person that I will find when I get to the clinic. They feel like it is a youth-friendly online platform that is also has an element of, being professional when it comes to the linkage to clinical services. And this is not something that is widely done, but I feel like if we had more of these platforms, we could actually assist with the issue of mitigating the HIV new infections that we always get annually between the ages of 15 to 24.
Thanks so much, Tshepiso, and keep up the great work with the cookie jar. Before we go, I wanted to hear once more from Sostain from OPHID. Because Emily, although you've answered a huge range of questions about digital health already, Sostain had a question for everyone working in this area.
I would like to see more of people like me being given a platform and support when they are doing their work, recognition and so forth. For example, we community health workers, you find that in most cases, they are volunteers. They are people with passion. They want to see their communities being capacitated, being, like in this case, we are talking of HIV and AIDS. Personally, I would want to see my community being HIV competent. They can deal with issues on their own. Programs come and programs leave. But we want to see the sustainability of this boost without OPHID as an organization. So without any other organization that is coming as a mother organization, because we know the organizations, they come and they have specific durations to operate in a given area. But my question would be, how are we going to see the Boost program or the Boost platform continuing even when the organizations like OPHID and other organizations have left? How are we going to be empowered to carry on when the big organizations are not in the community anymore? We need to own it as community.
Emily, surely this is an end goal for any new technology or new development, whether it's in traditional health or digital health. What do you think are the ways in which we should structure digital health interventions to try to build that sustainability component into
I would absolutely say that designing programs with a transition to local ownership from the start is imperative. We need to ensure that local systems and users are engaged and acknowledged from the very first days of project design. We shouldn't be selling solutions to countries, but rather working with countries together to develop solutions that resolve their problems. Many times, program designers often ignore the total cost of ownership, which is much more than the cost of laptops or tablets. But big ticket items that have yearly annual costs, such as trainings that account for turnover of new staff, funding of the health workforce, or maintenance costs for systems that are deployed, including How do you pay for new features or bug fixes when they arise? These different cost categories need to be included from the very beginning so that communities are fully aware of the costs of using digital.
Nicely put, Emily. How do we transition through that process and move to a future where we're truly able to take these kinds of technologies and use them to maximize their impact for people in developing countries?
I would circle back to documentation. I don't know that we are documenting enough of the great work we're doing. And I don't mean just documenting our successes, but documenting also where we fail. We need to ensure that we are capturing why systems work and why they don't, so that we can learn and continuously build new systems that are better designed to meet the needs of the end users they're meant to serve.
Emily, that was a great point on the importance of involving communities and users from the start. Now, in HIV Reimagined, we're all about thinking about the future. So, in my last question, what would you want to see done differently for the future of telemedicine?
I'd love to see all the companies that are developing telemedicine solutions engage with both the providers of services and the recipients of health services to ensure that they are part of the design process. So everyone from the doctor or nurse in the clinic to the elderly person struggling on the other side of the iPhone or the laptop. We need to ensure that systems are designed with them and for them. So health workers are able to provide the benefits of telemedicine, and patients and clients are able to reap those same benefits.
Emily, that's fantastic. Thank you very much. How was it?
Well, I have to say I was a little bit nervous, but it's quite an honor. And Shaffiq, really nice to meet you as well. So I appreciate the opportunity. I learned a lot in preparing for today's podcast.
Thanks so much, Emily. We've loved having you, and we learned a lot too. Thank you to everyone involved in this episode. Isabel, Sostain, Tshepiso, Lou, Leah, and of course, to all of you for listening. In our next episode, can you believe the HIV Reimagined team is getting rid of me? Well, not quite, but we're talking about things to do with youth health services with 4 incredible young people. So, for one episode only, they're getting rid of me because I'm obviously too old, and the Conversations for Change is being hosted by Stephanie Ndlovu, star of MTV Sugar and co-chair of the MTV Staying Alive Foundation board. It's not an episode to be missed, so hit subscribe to make sure you know when it's live. Thanks for listening to HIV Reimagined. Please do leave us reviews and ratings. It's always very much appreciated. I've been your host, Dr. Shaffiq Essajee, and goodbye for now.